Everything has changed so much, and we're all wondering if we can feel safe anywhere, maybe even the emergency room.
So the ER is no stranger to infectious disease processes. So COVID-19 is not something new for us. The disease process itself may be new, but how we handle those disease processes is pretty standardized. And so the ER is probably safer now than it's ever been. And you may ask why that is. Well, there's a heightened sense of infection control practices, right? Because we assume that every patient coming in with relevant symptoms may have COVID-19.
To ease our worries in the event of an unexpected emergency, it may help to know what it looks like in an ER right now.
So patients present either one of two ways, either ambulatory by walking or by car, private car, or they come by ambulance, right? And so before they even get to the ER, there's a screener stationed outside of the emergency department. That screener will then offer the patient a mask if they don't have a mask themselves. So once the patient is masked, they're brought into the emergency department where they have a quick temperature taken to see if they have a fever. They also have a very quick history, which is known as triage, to determine whether or not they have symptoms referable to COVID-19. If they do have symptoms referable to COVID-19, we then send them off to a separate area of the emergency department, which is specially equipped to handle those folks. After that, the patient will be seen by the physician and nurse for a brief encounter where a physical exam and a more detailed history will be taken, and the patient will be treated according to their symptoms and what their eventual diagnosis is.
So, the COVID patients are in one area, but what about everyone else?
Patients that we do not suspect have COVID-19 are placed into the core of the emergency department, which is a completely separate area. Again, safer for the patients and safer for our staff members. Our waiting rooms have about 50% of the furniture that they used to before. The chairs and seating is about 6 feet apart, just like the requirements are for social distancing. We also have chairs in the triage area that are about 6 feet apart. I think people's big fear is that they'll walk into a very crowded emergency department waiting room with people coughing and sneezing and showing signs of COVID-19 and not having appropriate social distancing, and that is absolutely not the case.
Wow, okay. That all sounds pretty streamlined. So what you're saying is that if I have an emergency, I definitely still need to go to the ER.
The tragedy that we're seeing is that people are avoiding medical care and suffering the consequences. By that I mean that they're having negative clinical outcomes because they're delaying care on critical life-threatening emergencies. The really troublesome issues are people avoiding emergency care for strokes and heart attacks. When they delay that life-saving care, they often have permanent deficits for life. In the worst-case scenarios, the outcome is death, unfortunately. Your risk of contracting COVID-19 is certainly no higher in the emergency department than any general public venue, and probably less for the reasons that we talked about.
All right, so I feel a lot better about this already. How do I know if I need to go to the ER?
So I think common sense rules the day when we're talking about how do I determine whether or not I need to go seek emergency medical care. And so there's a certain line of defense that you can take, one of which is to call your primary care provider first, right? And often you can get valuable information that way. The other option is to do a virtual visit, right? Do a video chat with somebody who may help you assess that condition and say, yeah, I think you might need to go to the emergency department to get that checked out. And the third is anything that's severe or persistent or acute in onset that is troublesome to you, that may be a threat to bodily function or well-being, should immediately set off a light bulb that should say, I should seek care for this situation.